Good evening. We are just going to start the recording and begin our January 2022 Health and Human Services Committee meeting of CB11. My name is Nye Whitaker, and I am the chair of this committee. And I'm joined by our liaison for this committee, Marlene. So we're going to get started with a little bit of housekeeping to make sure that this meeting, this Zoom, remains an inclusive and productive space. So first and foremost, it is 6:05. I'm calling tonight's meeting to order. And I'd like to share some ground rules as we get started. First is no one may speak until granted the floor. So I ask that you please keep your microphones on mute. If there is a reason that you will be sharing, I as chair will acknowledge you, and then we will either ask you to unmute yourself or Marlene will assist with unmuting you. CB11 members, if you have a question about board business or wish to make a motion, please raise your hands using the Zoom functions. If you click the participants icon, the participants panel should appear and you should find the raise hand function there. If you are still having technical difficulties and require any assistance, you may then click the chat icon and relay that difficulty to the staff, and Marlene or I will attempt to assist you. The chat function should not be used for CB11 board business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. The chat should only be used to alert us for technical difficulty or to relay important communications. Ergo, if a speaker is presenting and would like to share their contact information, they will then be invited to drop their name, title, name of the organization, phone number, email into the chat, as well as to state it verbally. So that those who are participating via Zoom or via phone will publicly be able to grab that information. When a member is given the floor to speak, I will identify you, and then you can unmute to add your comment or question. Please keep your questions and comments succinct and germane to the discussion. Members of the public, if you have a question or a comment about the subjects on the agenda, please also use the raise hand function in Zoom and wait to be recognized by the chair. We will now take attendance. Marlene, can I ask you to call the roll?
Eva Chan.
Present.
Thank you. Sandy Garcia. Robin Krinsky.
Present.
Thank you. Patricia Martin.
Present.
Thank you. Jennifer Meyer.
Present.
Shirley Pena. Arturo Perez.
Present.
Thank you. Pastor Isaac Scott.
Present.
Thank you. Robin Strachan.
Present.
Nye Whitaker.
Present.
You have a quorum, Nye.
Thank you, Marlene. So we're going to move forward with the adoption of the agenda for tonight's meeting. The agenda was distributed ahead of time by the board office and was also posted online. We're going to do this kind of by a consent. So if there's an objection to adopting the agenda, I'm going to ask you to please raise your hand, and that this is for committee members only, to please raise your hand via Zoom, and I will call on you. If there are no objections, we will move forward. So I'm going to give it a minute just to see if there are any hands raised. Marlene, are you noticing any hands raised or objections?
No, I don't see any hands.
Okay, so we're going to take that as an adoption of tonight's meeting agenda.
You're on mute, Nye.
See the minutes from our meeting. Can you all hear me?
Yes.
Yeah. Sorry, a call was coming in that I had to ignore. I wanted to make sure I didn't bump off the sound. The minutes from our last meeting were distributed to committee members ahead of time by the board office. If there's no objections, we will adopt the minutes from that meeting. Committee members, if you are objecting to the adoption of the minutes, I ask that you please raise your hand using the Zoom function, and I will give you a minute to be recognized. Marlene, are you seeing any? I don't see any.
There are no hands raised.
Seeing that there are no objections, the minutes from the last meeting are now adopted and are available on the website. So for the record, we're going to move forward. In the interest of time, we're going to move forward to the announcements. Is that correct, Marlene, on the agenda?
Yes.
Great. Marlene, is there anyone who pre-scheduled or registered to speak this evening? And if so, are they present?
Yes, Jeremy Markman from Mount Sinai. He's present and he's asked to speak in the announcements. Jeremy, I've promoted you a few times on my end to panelist, so just accept that on your end so you could move to the panelist section.
Are we having some technical difficulties? Do we need to go to the
He
next
just
person and come back? Okay.
He just accepted it. I guess you saw it. He just accepted it.
Okay, sorry about that. We thought that we were going to go towards the end. Is Matthew Allen on right now? Do you see any Matt?
Allen. Who else is
Matt
with you,
Allen.
Jeremy? I'm sorry, you didn't give
Yeah,
me
just
names ahead
Matt.
of time.
Just Matthew Allen was going to give the synopsis. I don't know if he's on right now. He should be on.
Yeah, I see him in the attendees and I'm promoting him. He just has to accept.
Okay, great. And if I can just share the links to from our speak out and stuff in the chat, is that okay?
Yes, that's fine.
Yeah, I think you should wait, Jeremy, just a moment till he speaks on the topic. And then you're
Okay.
welcome to do that and also just include whatever contact information for you and him.
Yeah, okay. I apologize. We thought we were going to go towards the end. Sorry.
It's okay. Are there any other announcements or speakers for this time?
You have a few hands raised, but do you want to allow Jeremy and Matthew to speak first and then call for more announcements?
Yes.
Jeremy, now he's giving you the floor to speak. You or Matthew.
Matt, are you on?
Yeah, I'm here. Hello, everyone. Can you hear me?
Yes.
Yeah.
Okay, wonderful. Thank you for having us. I'll try to keep this brief. So my name is Matt Allen. I'm a nurse that works at Mount Sinai Hospital in the labor and delivery department. So just quickly, we wanted to kind of tell you a brief situation that's going on in the hospital right now. I think due to timing, we won't have much time to get into it right now, but we're hoping to be able to discuss this more at the February meeting. So in short, I just want you guys to know that the hospital is currently in a staffing crisis. The hospital currently has over 300 nursing vacancies. And these vacancies are currently exacerbated by the current amount of nurses that are getting sick with COVID and out on quarantine. This staffing shortage was a long time in the making. We had staffing ratios that the hospital was supposed to be meeting before the pandemic and was not doing anything to meet those. And these are now exacerbated that more nurses are calling out sick. There are certain shifts when there's only 2 nurses on every unit, on select units, taking care of up to 10 to 15 patients at a time. This is putting the patients at risk and the nurse's license at risk. And the situation is only going to get worse as more nurses are burning out the situation. And likely going to be leaving bedside nursing to do travel agency to get more money. So basically, we can post the links to kind of more information that we've had about this. We also did a speak out regarding this on the 15th that had some media and politicians present. But right now we really need solutions and we need the hospital administration to come to the table and help us fix this crisis because currently they aren't doing anything. And as a result, nurses are suffering and the patients are suffering as well. So that's something that we would like to be able to talk to you more about later on. But please look through the links yes, thank you.
Sure. And so my understanding is that there's a request that Jeremy made for time on our February agenda, which we will grant. You're going to share some, or it probably has already been shared today, but that you're sharing information about a resolution that you're taking around to several community boards. Is that correct?
Yes, that's correct.
That you would like support for. Okay. Thank you for bringing this to our attention. As you know, we actually have Mount Sinai presenting today.
Mhm.
And it's important that, we are not only taking care of those in need as patients, but we are taking care of our essential workers. As an essential worker myself, I think that that is a priority. So we look forward to continue the conversation. We say thank you to all of you for your work, and thank you for presenting tonight. And we look forward to having you back on the agenda for February.
Thank you.
Thank you. To the committee members, it is our standard rule that any considerations for resolutions or review of letters or documents need to come to us in advance of the meeting so that they can be shared with all the committee members for review and posted to the public as part of our agenda. And because of timing, that was not possible. So this item will now be referred to the February agenda. Are there any members, because there's a lot of hands raised and I'm not sure what's what. And so here's what I would like to say. If you could please take your hand down for now so that I can acknowledge only anyone who has a question or comment regarding this announcement, because there's a lot of hands raised. So if your hand is not raised, specifically for a question or comment to this announcement about the staffing of nurses situation at Mount Sinai, I ask you to please put your hand down and then re-raise it if you would like to comment or have a question about this Mount Sinai nursing staffing situation. Joseph Di Benedetto, is your hand raised regarding this particular announcement about the situation at Mount Sinai? And if so, you're welcome to unmute yourself. Joseph, I'm recognizing you. If you could please unmute yourself. Marlene, I don't know if we need to assist him.
Okay. Okay. Is everyone able to hear me?
Yes, we are.
Yes.
Okay. Thank you. So I just had two questions for Jeremy. The 300 vacancies, is that specifically the Mount Sinai in East Harlem? And also considering this says the New York State Nurses Association, is there a recommended nurse to patient ratio? I know there's probably nuances between that, but I was just curious if there is a general recommended nurse to patient.
Thank you, Joseph, for those questions. Jeremy, would either you or your colleague be able to answer those two questions?
I would refer this to Matt Allen.
Okay. Hi. So the 300 refers to system-wide, but the majority of those are at our hospital in the Upper East Side because it's the largest Mount Sinai facility. There's specific ratios for different units. So the ICU has, a specific ratio they need. Labor and delivery has a ratio they need. Med-surg has a ratio they need. So it just depends on the particular unit.
So for example, Matt, for your unit, when you say I'm just being hypothetical, there's two on duty for 15 patients, what would be normal or what would be appropriate?
So for the grid for that particular unit that was suffering with only 2 to 3 nurses per unit, which was leaving them with, 10 to 15 patients, there should ideally be around 8 or 9 nurses on that unit. And then, different answers for different units. So on my unit, we should often have, 20 to 25 nurses. Lately, we've been operating with, 12, 13 sometimes.
Thank you for that clarification. My mother worked at Mount Sinai for 50 years, so wanted to just make sure we were being exact and giving people a sense of what we're talking about.
Yeah,
and then there was a second question about a solution to the problem. So I'm assuming in the materials that you're going to share will be what the nurses there and the organization are looking for in terms of a resolution to the challenge or possible ways that this issue can be solved. Is that correct?
Yes, that's correct. It'll provide more information about what we feel like will be happening, but a majority of the ask is just to help us advocate to the hospital to listen to us and try to come to the table with solutions, because so far we have brought this up time and time again that this is an issue, but it has not been addressed at all. So we just need help kind of like, you know, allowing us to even hear the solutions that we want to bring out.
And sound the alarm. Okay. Is there any, I see that there was another hand raised. I don't know if that hand has gone down. Marlene, was there a second person? I saw two previously.
I don't see any hands raised.
Okay. So then I'm going to move forward off of this issue. Thank you, Matt. Thank you, Jeremy. We look forward to seeing you back here in February. We appreciate you bringing this to our attention. We will definitely share the information out.
Thank you so much.
Thank you. Marlene, next. So if anyone was raising their hand to make an announcement, I believe I saw Robin and others. If I could ask you to please re-raise your hand so that I can acknowledge you for this announcements section. So Robin Strachan, I'm going to acknowledge you next.
Thank you, Nye. My organization is Search and Care helps older adults in the community, Upper Manhattan, and we're doing a Spanish-speaking only workshop with the 23rd Police Precinct about scam prevention. So it's going to be on Valentine's Day. And I wish I could say it in Spanish, but I can't. It's going to say, love yourself, protect yourself. And this is open to any Spanish speaker in the community. So if anybody would like a flyer or some materials to share or would like to attend, I'm going to put my contact info in the chat. Thank you.
Thank you, Robin. That's so important. I know so many people are finding over this period of the pandemic that they have been, victims of scam and fraud. So thank you for that.
There's tons of workshops for English speakers, but very few for Spanish speakers, we found.
Thank you. Thank you.
You're welcome.
Great. Next, I'm going to call, I'm sorry, does anybody have any questions about that? Okay. Jaime Gutierrez, seems like you have your hand raised. I'm assuming you'd like to make an announcement. Is that correct?
Yes. I hope you all can hear me. I'm Jaime Gutierrez. I'm acting manager of the Action Center here in East Harlem. I know I have a place on the agenda now, so I'm going to hold my vaccination updates until the agenda item, but I did want to introduce Priscilla de Jesus, who should be on the call to promote the Family Wellness Suite. We have a lot of free stuff to give to new and expecting parents, and I'd like her to talk a little more about it, if that's okay.
Sure. Yeah, please go ahead. Priscilla was the name?
Priscilla de Jesus, yeah.
Priscilla, are you on? If so, you can unmute.
Hello.
Welcome.
Good evening, everybody. As Jaime said, my name is Priscilla de Jesus. I'm the coordinator for the Creating Breastfeeding Friendly communities, and I work with the Family Wellness Suites, which are housed within the Health Department Neighborhood Health Action Centers. We're located in East Harlem on 158 East 115th Street, and as Jaime mentioned, as part of the Family Wellness Suite that addresses factors that contribute to maternal health, we do distribute car seats prior to expectant persons must be about 27 weeks. So that's their third trimester. They do have to take an online course, but Jaime can put the links in and whatever comes through, and I'll make sure that they get all the information. And we do have pack and place, what we call cribs. So portable pack and place that can distribute. We do have plenty of them, so we want to get the word out. And we do have an emergency diaper distribution going on. We have a couple of sizes, newborn, size 2, 3, and 4. So if you're interested in those, we can get out. We also have some, we're working on the policy for distribution for strollers. So it's a universal stroller where the car seat can adapt to it. So these are great things that we know that our community needs. And we also offer virtual training, which I can put on the link. We have baby cafes, would have an international board lactation counselor that can provide support for women that are breastfeeding. Actually, our baby cafes address more than that. So anyone that's expecting or that wants to connect to a doula or wants some more information about breastfeeding can join our support groups. We also have some other virtual programming going on, such as preparing for your first newborn visit, where you can learn how to prepare for the baby's visit, which normally takes 3 to 5 days after birth. And we have also a workshop on the 4th trimester and newborn care classes as well.
Great.
So,
Thank you so much, Priscilla, for sharing that with us. All of those programs sound great, especially the stuff. I know there's so many families in needs at this time. So if you could please put your information into the chat and any links to the site so that we can share that with the public, I would appreciate it. I next see Travis Thomas. Travis, are you asking a question or do you have an announcement?
I have an announcement. Thank you so much for acknowledging me. I appreciate you.
Sure.
Hello,
And
thank
your
you so
first
much.
name, Travis, is that correct?
Yes, ma'am. Travis Thomas.
Perfect. Go for it.
Thank you so much. My name is Travis Thomas, and I'm the CEO and founder of Save for Life Cancer Corporation, as well as the National Cervical Cancer Coalition chapter leader. I will make it short. I want to make the announcement that we will be opening up our first cancer resource station in Harlem this month, at the end of the month. We are in partnership with Street Corner Resources, Aisha Suko. We'll be doing that for Harlem. We're also opening a cancer resource station in the Bronx as well, in partnership with Step Up to Better Living. We have partnerships with Mount Sinai, Montefiore Hospital, as well as Columbia. These cancer resource stations will provide free cancer patient resource navigation, as well as support for cancer patients, families, and their survivors. We will also be navigating care back to the medical oncology facilities that refer them to us to navigation after their care, after they are done with the hospital. I thank you so much for your time. Definitely want to let everybody know about that, and that this month is Cervical Cancer Awareness Month, and we will be having extensive events throughout the whole month. I would love to forward you the information in regards to the Cancer Resource Center and the services that we provide that are free throughout your from outreach all the way to end-of-life care for all those in the community, as well as survivors and patients. Thank you so much for your time.
Thank you, Travis. Two quick things. You said that you're going to have a resource center here. Do you know where it will be in Harlem?
Yes, we're going to be stationed on 130th Street, but we're also going to provide services on 145th Street as well, between 7th and Lenox. So it's only the cancer resource stations. We have one that's going to be opening in Long Island as well, trying to reach all of the 5 boroughs. They will be open only for 2 days out the week. 2 days out the week in the Bronx, 2 days out the week in Harlem, and we provide virtual as well as over the phone and in-person services for cancer patient navigation. And I'm not sure if everybody knows what that is, but it helps to break down the barriers to timely cancer care. I look forward to coming back again and explain exactly the services that we have and what cancer patient navigation is at some point in time.
Thank you so much, Travis. Please drop your information into the chat and any links, and you're welcome to email our CB11 staff if there's anything else that you would like to share out more widely vis-a-vis our CB11 newsletter. Thank you so much. So it looks like I have 2 other hands raised, and it looks like I've got Meta Clemens. Is that, I don't know if I'm pronouncing that correctly. And it looks like after that, then we're going to close out with announcements. Is there a Meta Clemens with a hand raised?
It says that this person is using an older version of Zoom. So I will promote you for panelists. And once you finish your announcement, Meta, I'll just put you back to the attendees. Okay, no problem. Meta, you should be able to unmute yourself on your own.
Hello, my name is Meta Clemens, Meta for short. I'm the founder of Research. I'm also thank you for allowing me to participate. Really appreciate that. Yeah, but I'm the founder of a research firm called SELA, and SELA is dedicated to helping the public speak responsibly about public life. And the way that happens is that we construct systems of logic that enable the public to test propositions for certain kinds of qualities like accountability, clarity, empirical veracity, and honesty. And our goal is to just sort of help civic bodies such as yourself determine when a proposition that wants to enter into your civic body has the kind of qualities to be admitted by you as meaningful. We think that's kind of important, and we think that some public issues are really complicated and that there needs to be talked about in a certain kind of way. And you use rules to govern what counts and what doesn't count as a meaningful public statement. You can protect your political discourse. So really what I intend on doing is just participating in some of your committees. And then when an issue comes around that you feel is really complicated or you want to protect your discourse from, I suggest a set of rules you can use to test if a proposition has the kind of qualities you think are meaningful enough to you to participate within a particular kind of dialogue. So I'm going to see me around here a little bit. I'll probably just stay to myself and just kind of send some suggestions. And if you want to use them or not, they're up to you, but we just want to help you increase the quality of dialogue when you feel it's
Meta, we're having some issues, or at least I am. I'm hearing your full presentation. So first of all, I'm going to thank you for presenting. And I'm going to ask if you can just drop your information, your name, your email, phone number, and any sort of link into the chat, because it does seem like your connection is going in and out. And I want to make sure that everybody has a fuller picture of what you're trying to communicate. So Marlene, I'm going to ask if you can take him back down from panelist to participant. Any sort of
Yep, you can move forward now. I'll do that on my end.
Great, great. So I'm going to go ahead and move over to the next speaker. We're now starting our informational updates. The first speaker on our agenda is from the Office of Congressman Adriano Espaillat. Nina, I see you here, my sister. The floor is yours to give an update. Thank you.
Thank you so much. Now, can you hear me clearly? Okay, great. So I had my camera on, so I wasn't able to see. So can you guys see me? Am I clear? Perfect. Thank you so much. Again, thank you, Chair Nye and Marlene. Thank you so much for inviting me on today. So I'm going to make my informational update as quick as possible. So I have some links available right now for the city and state, links for organizational test form for rapid test kits and KN95 mass distribution program. I also have one for a vaccine finder. So if anyone in the community needs to find out where the latest locations around your area so you'll be able to get vaccinated, as well as NYC testing locations. So as we all know, they're popping up and shutting down on various areas all over the city. So we try to, of course, make sure the NYC keeps that information, up to date so everyone knows where they can go and get tested. We also have the NYC Health and Hospitals testing sites as well. Same thing, they'll keep all the latest information up. And we also have a link for a complaint form. So not to let that word kind of scare everybody, but just if you know of, if you hear of anybody who may not be using their resources to the best of the betterment of the community, or if you see maybe they're kind of taxing and going a little bit above and beyond, you can fill out the complaint form, and at that time it will be looked into. So I'm going to definitely drop all of those links in the chat, as well as my contact information, and the Congressman's office would be more than happy to follow up with any requests to any of these links put in by Community Board 11, by myself, as well as our district director. So unless anyone has any questions, that'll be about all for me. I'm sorry, Naya, I can't hear you.
Yep, I have one question, Sister Nina. I was
Sure.
hearing today that the Biden-Harris administration is in the process at the end of this month being able to have a website where people can, ask or I guess sign up to have test kits shipped to them, and also that there was a new I guess, structure put in place or in the process of being put in place to mandate private healthcare insurers to allow 8 home tests or 8 kits, per individual going forward. So I just wanted to say, East Harlem is one of the areas that was heaviest hit when the pandemic hit the first time. We continue to be a place of essential workers and people who, are out there every day. We also have those who may be who without healthcare or other resources. We have our seniors. So whatever we can do to make East Harlem a priority for these future distributions as a member of, the Congressman's district, our Health and Human Services Committee and our community board would like to be in partnership and work with you to make sure, we know that there's something dedicated at the Harlem State Office building but even for many of our residents, that's too far. So as we work to go forward, if there's a way to get some sort of placement in East Harlem, again, I just want to make sure that that's a priority. And that is a question that we often get from our community members is, we have like the East Harlem Health Action Center. Maybe there's something we can do there. What can we do, at our places here to make it more convenient? Because there's a lot of people, especially in COVID, who just aren't even going to go to the West Side, even though it's a few blocks over because they're afraid. They're afraid or they're frail. And so whatever we can do to make East Harlem a priority, please keep me posted on how we can bring those resources here.
Absolutely, absolutely. And if you would like, we definitely could have a further conversation offline, and then, we can do an email chain, and that way, the locations in East Harlem that are available, we can have that information. And definitely I will make sure that I update my director, Shauna, with your concerns, and we definitely will keep an open line of communication with Community Board 11 going forward. Absolutely.
Thank you so much. Are there any other questions for Ms. Norwood? I don't see any hands raised. Thank you, Nina. I'm going to move on to the next speaker. So this is the point in our meeting where we usually have a quick update all about the COVID testing sites and other information. So Jaime, if you are still here, I'd love to call on you. And I don't know if usually at this time, I always call on Metropolitan as well. I know that we have Borican here, we have Mount Sinai here. So I'm going to start with Jaime, and then we can go to any of the others who would like to give an update about their services, dates and times of access. So Jaime, are you here from the Health Action Center?
Yeah, I'm here.
Thank you.
So good evening, everyone. As you all know, we continue to be a vaccine site here in the East Harlem Action Center. We're open Mondays to Saturdays from 9 a.m. to 5:30. We accept walk-ins and encourage appointments. You can make an appointment by calling 311 or going to vaccinefinder.nyc.gov. We are seeing an average of about 400, or we're administering an average of about 400 vaccinations a day. The most popular currently is Pfizer. We are seeing a slowing down of foot traffic into the building, but that might also be a result of the $100 incentive for the booster being finished. We are also we were giving community testing kits. We are running low on the inventory on our end, so I will be reaching out to Ms. Nina Norwood via chat. We also are experiencing similar struggles to Mount Sinai. We are seeing a high positivity rate in the building here at the Action Center. So we do give staff test kits out every other day. There's 2 tests per kit. So anyone that is DOHMH staff that is involved with the vaccination effort, as well as the affiliated physicians, the contractor that administers the vaccinations, they get a test kit from me every other day. We also, because of our staffing shortage, have National Guard that's been deployed to help vaccination sites across New York City. We currently have 2 here at the East Harlem Action Center. They're very nice, very pleasant, very helpful, and I'm just looking to socialize that the National Guard is here in the building to help us out. And that's it for me, unless there's any questions.
Nope, thank you. I really appreciate the work that you guys are doing. I'm gonna ask Noel from Metropolitan to give an update.
Hi, good evening, everyone. Can you hear me?
Yes, thank you, Noel.
Thanks, you, Chair. A few quick updates. We also continue to provide testing and vaccine. We've expanded our testing hours to 7 days a week, 7 a.m. to 7 p.m. Over the holidays, we saw, like everyone else did, a huge surge in demand for testing. So we were able to expand our hours. We still have, as of the weekend, pretty long lines. Test results are still coming in 24 to 72 hours. We do PCR testing in our location on 97th Street. We have been able to a limited extent to provide at-home test kits for people who do not want to wait online, but those run out pretty quickly. And as everyone else has experienced, the supply continues to either dwindle or go to other places. We understand that a lot of the testing kits have been sent into the schools to alleviate their demand as well. So we're working with what we have. We have also had a significant number of staff test positive or have to be out for quarantine, et cetera. We have not experienced any interruption in care. So we're happy about that. In terms of vaccine, we still provide vaccine Monday through Saturday. That includes boosters, and it includes boosters now for ages 12 and up. We provide Pfizer at our location. We have a limited amount of Johnson & Johnson, and we also have a vaccine first round of doses for kids 5 and up. The vaccination for children is by appointment. For adults, or rather for 12 and up, we prefer appointments through Vaccine Finder. We are able to take some walk-in, but when the demand is too long, we have to cut off the line. Those are the kind of highlights for vaccine and testing, which is kind of the huge focus of our work, obviously, these days. I do want to also acknowledge and thank members of our community, including members of the community board, who supported our annual toy drive. We had a very limited pediatric holiday celebration this year. No party, but we were able to give out lots of gifts, especially with the help of our community. So thank you. And Happy New Year and Happy Three Kings Day to everyone. Thank you.
Thank you. And I just want to also thank you for your partnership with Union Settlement and hosting the the marketplaces and supporting our small businesses and making it easy for our community, in this challenging pandemic to be able to still pick up gifts and support our small businesses. So thank you guys for your work as always. Arturo, did you want to say anything quickly for Borican? I'm sorry, please. Was someone speaking?
No, it's Brad. I can update too at the appropriate time. Let me know for Mount Sinai.
Yeah, I will.
Okay.
I'm going to do Borican and then I'll come to you. Is Arturo on by any chance? I know Borican has a separate update. But all right, if you want to say anything about the services you guys have related to COVID, let me know.
Yeah, I think that's going to be included in the update that Anne-Marie is going to present.
All right, so I'll wait for that section. You guys are next right after this. Brad, is there anything else you wanted to add about your services?
Absolutely. And again, hello, everybody, and Happy New Year. And again, it's Brad with Mount Sinai. We at Mount Sinai obviously continue to do both COVID testing as well as vaccines. We have sites that are open. They're actually open Monday through Friday from 8:30 a.m. until 5 p.m. Obviously, with regard to vaccine, that is both for pediatric vaccines and adults. Primarily, we use Pfizer vaccine. We do have some J&J, but really mostly it is Pfizer. Obviously, we encourage everybody to get vaccinated and boosted as well. With regard to the testing, we do the PCR testing. To give you a little sense of the volume, to date, we have actually administered more than 350,000 vaccines. Again, that's first dose, second dose, and boosters, but we now have exceeded 350,000. In addition, we're actually partnering with regard to testing with New York City and specifically with Health and Hospitals. We actually, with them, are staffing, and we've had over 800 community testing events throughout the city. H&H actually chooses the location. These are at senior centers, NYCHA centers, and other community sites, but we now have had more than 800 of them. So, and those primarily are a saliva testing that we do. In addition to that, we actually are doing for the testing for the MTA for their unvaccinated employees. And I think to date, we've done about 150,000 vaccinations, or not vaccinations, tests for the MTA. To also give you a snapshot of our total hospitalizations, this goes up and down every day, but roughly currently in this round, about a third of our hospital inpatients have COVID. To give you a sense of those numbers, as of this evening at Mount Sinai Hospital, 98 Madison, we have 260 COVID patients. And as a health system, we have more than 900 COVID patients. And our ED volume continues to go up. This obviously is something folks are experiencing citywide, but our ED volume in this surge has gone up more than 30%. And obviously, we too continue to have staffing challenges as more and more of our staff are on home isolation due to either exposure and or COVID symptoms. So happy to take any questions, but I think that's a high level overview.
Thank you so much for that. I'm gonna now turn the floor over to the East Harlem Council for Human Services with the Access NYC update.
Hello.
Oh, 1 second, I'm so sorry. Travis, did you have a question? I just saw your hand come up before we transition. Okay. Anne-Marie, please go ahead.
Hi, how are you? I'm Anne-Marie Vasquez, a Marketing and Community Outreach Manager at Borinquen Neighborhood Health Center, which is one of the 4 programs that East Harlem Council for Human Services provide here in the East Harlem community. I have a PowerPoint presentation. Can I share?
Marlene, can you give her access so that she can share her screen?
Can you guys see?
Yep.
Okay, great. All right. Okay, so East Harlem Council for Human Services is our agency. It's located in 2265 3rd Avenue, New York, New York, 10035. 212-289-6650 is our number. And East Harlem Council for Human Services, we have 4 programs. The first one is the Bilingual Headstock program, where we have 2 sites. One is on 116th Street and one is on 111th Street. And tentatively, we will have one in Taino Towers. We're working on the logistics on that one. We also have Borinquen Neighborhood Health Center. We have the WIC program. And we have the Senior Nutrition Program at Casabe Housing. Actually, we have 2 sites. The one on Schaumburg is currently closed for renovations. The Bilingual Headstart program provides comprehensive bilingual educational and nutritional services for the 12 months per year for 3K and pre-K. They have inclusive programs that allow them to identify and address learning differences to support lifelong learners. The emphasis is on wellness and nutrition. They cook their meals for the children, breakfast and lunch and snacks. And they prepare students for school readiness and enhance their cognitive and social emotional development. They they prioritize parental involvement in the educational process with workshops, advocacy, and events. They serve around 260 children right now and are currently enrolling new students. We have the senior nutrition program that provides supported recreation and hot meals for seniors on the weekdays. They are located, like I said, in Casabe, in their cafeteria as a senior center at the Casabe housing and in Schaumburg, but now it's currently in renovation, so that one is closed right now. Also, they have wellness calls to check up on their clients, making sure they're getting their vaccinations appointment, mailing out PPE. They have casework assistance, workshops on health and social services. They translation services in all languages. They provide a safe haven for seniors. Right now, they are providing congregate lunches where 7 seniors sit at a table, 6 feet apart, for 30 minutes. And they also have grab and go meals for those that don't want to stay in the cafeteria. They provide hybrid classes and activities such as bingo, they have birthday acknowledgements, virtual classes, Zumba, and is limited 7 to 10 people, and they're currently accepting new clients as well. The WIC program, it's a program that's here at Borinquen on the 3rd floor. It provides nutritional foods to low-income pregnant, postpartum, and breastfeeding infants and children up to age of 5. They provide them information on healthy eating, including breastfeeding, support and referrals to other health and social services. They also refer to our pediatrics department here at Borinquen and also dental and behavioral health. They also have health bucks during the summer where people can get fresh fruits and vegetables and individualized food packages. They right now providing 1,300 nutritional services to enrollees and currently enrolling new patients, but now they just providing the services remotely on the phone due to COVID. Borinquen Neighborhood Health Center is our health clinic that provide medical, dental, mental health, and psychosocial services, which includes, we have pediatrics, adult medicine, women's health, pharmacy, dental, nutrition, podiatry, dermatology. We have an on-site laboratory. We have care management, optometry, which is one of our new services where the optometrists also can provide the frames. They can be done here in Borinquen. Behavioral health care management and cardiology. We have HIV/AIDS services, which includes education and outreach, HIV testing, PrEP navigation, primary care, counseling, and case management. We have a lot going on here. Additional services, which is more of my department, is the COVID-19 vaccines. We have a vaccine site here at Borinquen where we have been providing the first, second, and the booster vaccine to the community. It's open to everyone. We also have on-site COVID-19 testing, but that's for patients right now due to the fact that we have a lot of things going on here and we don't have the capacity or the space to do both vaccine and testing. So right now we're focusing on the vaccine, but still testing our patients when they're here, seeing their provider. We provide flu shots. We also have a food pantry for patients, those patients that let us know that they're in need. We have a food pantry here on Wednesdays that we work very well with and very close with Friendly Hand Ministry. They provide us the food for these patients. We have a mammogram van that comes twice a month here. And we have a new medical outreach van, which I run. We will be out in the community. As a matter of fact, tomorrow's our first day at Lehman Village, where we're going to provide information about our services. Right now, we're going to provide at-home COVID-19 test kits. We're also going to do HIV testing, diabetes, high blood pressure, HIV, Hep C, and we're going to see, we also going to do COVID testing and vaccines. In the van, it's private. It's going to be medically equipped as well. We do monthly outreach events here at Borinquen and outside in the community. And now our new thing is the at-home COVID-19 test kits, which right now we have been, since last week, providing people in the community and our patients who come in and want to get tested. We have been providing them a kit. So far, we've provided 200 kits since January 6th. And soon we'll be out in the community providing kits. You just have to let me know. My information is at the end. And that's the plan now with the COVID-19 testing kits. And my department so far have, since July until now, have reached 3,031 people. We have provided the education on vaccines and help them obtain the vaccines as well. And 3,353 people have received information about all our services. So that's what's been going on here in Borinquen, and thank you. And if you have any information or any brochures, reach out to me. That's my information. We have social media at the bottom, and these are our brochures. That's it.
Awesome. Thank you so much, Anne Marie. Travis, your hand was up previously and then it went down and came back up. So first, I'm just going to ask before I get to you, are there any members of the Health and Human Services Committee that have a question before I go to the general public? Not seeing any. Travis, you can unmute. Looks like the hand went down again.
I got it. Okay, I'm sorry about that. Okay. I was having a hard time finding that button right now. Yes, I had a question for, definitely for Mount Sinai. I do apologize. When you called on me, I didn't react fast enough to get to that button. I apologize. My question for Mount Sinai was, we have 18 buildings, residential buildings, and 13 community rooms where we would like to do vaccinations as well as testing for our residents. And I would like to know, do they come to buildings to do the testing for residents? And I have a question for Ms.
So it's Brad. Can you hear me?
Yes, sir. Mm-hmm.
Yep. There may be a couple of options. So in our partnership with H&H, yes, they do go to some buildings. So if you want to reach out to me, I'm happy to try to connect you actually specifically with H&H to see if we can get something set up, because they do coordinate those. As far as our direct outreach, that is more difficult only because of the vaccines that we have are J&J, not J&J, are Pfizer, and their storage issues. So if you reach out to us, we'll try to set something up.
And Travis, just FYI, usually we are joined by a member of the Test and Trace team. And I will also drop into the chat Fernando's information. He is the Manhattan Borough Outreach Director for Test and Trace. He actually replaced me. So I will drop his information into the chat. I think he could be a very good resource. They just hosted last week, Thursday, at the council member's office, and they had like 115 people tested and gave out vaccines, et cetera. So I know that they can probably work with you to do something different. They've been in Wagner houses, they've been to Taft, et cetera. So I will also drop that information into the chat. I saw that there was another hand raised and it went up and it went down. So if I'm missing anyone, Marlene, I don't know. It went up and it went down. Robin, was that
she
you?
raised her hand and then she put it back down.
Yeah, Robin, did you have a question or comment?
I didn't have a question, I have a comment. There is a wonderful pharmacist on 116th Street. It's called Uptown Care Pharmacy. They do home visits to do vaccinations and boosters.
So look at, you have all the community coming to help you, Travis, and give you lots of options. one person can come on one day because you have so many units. It's maybe another group does another building, and we can really get this going and be of service. And of course, there's also just the phone number to call for home visits as well.
Thank you.
So I will drop that into the chat. So we're gonna move forward. Thank you to all of those who presented. It is 6:58 and we have two really important presentations on the agenda for tonight. So I want to ask everyone's patience and flexibility, because it's really important that we hear from both of these two service providers in our district. So first up, we have Odyssey. As everyone knows, we have been working since I became chair on a project where we are inviting different service providers, asking them to complete a questionnaire, having them come and present to us so that we can better understand the services that they provide, how we can work better in collaboration, and what we can do to support not only these organizations and their good work, but also the people that they are, treating and providing services to, and work in partnership as a community. So I know that next up we have Odyssey, and I'm actually going to turn it over to Marlene because she knows who all of the presenters are and she can see if they're here or not here. So Marlene, is Odyssey House ready? I believe it's been published that you have 15 minutes on the agenda. I will defer about how we moderate or handle the questions portion. So first she'll be able to present, and then we'll open the floor to questions from the committee members, and then questions from the public And then, of course, you'll have a chance to respond, and then we'll close out and then go to the next presentation. Everyone, please stay. After Odyssey House, we have a presentation by Mount Sinai. So Marlene, the floor is yours.
Presenters for
please.
Odyssey are here.
Yes. Awesome. And in what order is Fernando, Gabriel, Isabel? I just don't know what order you guys are going in. So I'm going to open up the floor to Odyssey House to present in whatever order that you think is appropriate. It is now 7 o'clock and you have 15 minutes on the agenda.
Okay, thank you very much, Nye. Thank you, members of the committee, for having us come see you tonight. My name is Isabel Surface. I'm Senior Vice President for Odyssey House, and my job there is communications and fundraising, media relations, etc. So I'm going to give you a sort of brief overview of Odyssey House and our programs in East Harlem. So hang on a minute, and I'm going to share a screen. Oh, and then after me, I have with me, let me just say, Gabriel Ramirez is the Senior Director of our residential programs. Gabe is located mostly on our East 121st Street program. And Fernando Brin is our Community Relations Consultant who has worked with us for more than a decade on community concerns. So if you have questions for him and for Gabe or for me, but I'm going to start off with the presentation. Okay. Hang on a second, it didn't work. Go back into my presentation, as usual, we had this all ready to go and then it just timed out, so I'm going to have to get that going behind the scenes. But meanwhile, can you all hear me?
Yes, Isabel,
yes, we can.
To help you, do you are you or anyone else on your team presenting? Is it just you? I have the presentation. Do you want me to queue it up on your behalf? Just let me know.
Okay, if you want to, it's the slideshow. Yeah, the slideshow
No problem.
presentation.
Okay. Just give me a second, please.
Okay. So if I don't know how many of you in the community are aware of Odyssey House. We've had programming in East Harlem since 1973. So we've been really involved in the district for close to 50 years now. Here we go. Here's the presentation. This first slide is of our main treatment and admissions unit on 121st Street. This is a large building that has now services for adult men. It used to have services for families and adolescents as well, but we have changed location for those now. So this program, those are the individuals that are there. It's a residential program exclusively. It has the admissions unit in it as well. That's the Odyssey House Manor. That's the program where Gabe, who's joining me on the presentation, is located. He has overall management of this and some of our other residential sites close by. That one. The second one, this is a newly renovated, for us, newly renovated large residential program on Ward's Island. We've had half of this building in operation since the 70s when it was sort of given basically by the city to Odyssey House to sort of make use of. And then about 10 years ago, we embarked on an effort to renovate it, and that took about 7 or 8 years. And it was reopened in 2019 as the George Rosenfeld Center for Recovery. George Rosenfeld is our long-term board chairman, who has been a big supporter of substance abuse programs and the efforts that Odyssey House has undergone and does every day there. This building has our Women and Children's program. We're one of the few social service providers that does this. So these are young women, by and large, who can come into Odyssey House if they're pregnant or they just had a baby and they keep the child with them. We take children who up to about 5 years of age. after about 5, it's really better for school reasons, for the child not to be there with mom, but they can come visit. This is a very successful program. It's an intensive service program. It has attracted quite a lot of federal grants as well. We have on-site childcare, on-site Headstart, a range of social service programs to help with housing, to help with vocational adjustments, and also sort of seeking safety for women who are victims of sexual abuse. So that's this program on Wards Island. You'll see that half the building actually is for the women and children. And then there's a central piece that has administration. And then the second wing is another sort of fairly unique Odyssey House program for older people with substance misuse disorders. We call this the Odyssey House Elder Care Program, but it's for people over the age of 55. This has 100 beds for that community. It is always full. Right now, I think we have about 90 men and we have about 10 women. This program has been sort of running since the mid-1990s. So both of those populations are on Wards Island for us. We're just across, you can't really see it in that photo, but from the RFK Bridge, come over the island, you sort of drop down and then you see this building there. So that's the Wards Island one. It also has, as does the Manor program that I just showed you on 121st Street, they have primary healthcare facilities run by our healthcare providers called Damien Family Health, and they're an FQHC. So all of the services that we can provide for residential care happen within both of those sites. There is very limited reasons for clients to sort of travel about the city to leave the program. They are self-contained services there. And, and we have always encouraged members of the community to come visit us. It's been more difficult the last 2 years where we really had to keep down the number of visits into these programs. As you can imagine, these are residential centers where our priority has been to keep the residents safe and the staff safe. So, we have operated a very tight ship there. But I'm happy to say we have had people in hospital. We have had COVID positives amongst the staff and clients. We have had no staff members seriously ill and no clients at this point. So we're very thankful to report that out on COVID. So if you go to the next slide, this is also an Odyssey House building on 121st Street. It's on the same side of the street as the Manor, going towards First Avenue. This is a permanent supportive housing building that was completed in 2001. It's funded by New York City HIV/AIDS Administration by and large, but it's not exclusively for people with HIV, living with HIV/AIDS. It can be for individuals with other chronic medical conditions and disabilities. This is 62 units, mostly studios, but there are some 1-bedroom units in this building. This one also has the Odyssey House art program. There's a couple of slides there to show you what that sort of looks like inside in the common areas. It's a very sort of proud thing at Odyssey House that we have a very active arts program for clients in the housing as well as in the residential programs where they can sort of create art, and we do shows. And, and before COVID, we had one of these every year and the community would come and visit. And so right now we're thinking of doing one in the spring, and as long as it's safe to do so, we will invite everybody in to come and have a look at the art, which, we're very proud of. So the next slide, this one is Odyssey House Park Avenue, which is on 123rd Street, going towards Park Avenue before you get to the train tracks. This one is a semi-permanent supportive housing program funded by the Office of Mental Health. So these are people, it's studio apartments. This is for men and women who are coming out of, sort of long-term psychiatric care. who, are stable and able and, can live in the community with some support. This one was built, I'm going to say completed in 2010, but don't hold me to that. I might have got that date a bit wrong. So this is, I think if you go down again, that's it for the Odyssey House services in East Harlem. Oh, no, I can't take over the slide. Okay, here we go. These are photos of the building, and also just to show you the sort of men and women that are in our programs.
Are you on the slide, Isabel? I'm sorry.
You can go on to the next slide.
Okay.
These are, I wanted to, give you a sense, Odyssey House, if, many of you on the community board will have known us for a long time, know us to be involved in the community. One of the biggest things we do every year is get out there and work on the mile 19 water station for the marathon. Something that we're very proud of. We field a team of 40 to 50 runners every year to participate. These are majority former clients or current clients, and also we fundraise around this. And we get out there and we have all the clients helping with running the water station, as do many staff, and many people get out and do that. We're very proud of that one. If you want to go to the photo there of the two folks holding up signs for John Tavalacci are Janice Glenn and Milton Slaughter. Janice runs our mental health programs, and Milton Slaughter runs our admissions unit. If you want to go to the next slide. So this is just a little bit of an overview of different things we've been doing over the last year or so to support what's happening in the community with substance abuse. And also, I don't think we have any photos of our COVID activities and our drives to help with that effort, but we're also involved in that as best we can while we keep everybody safe within our clients. So we do a lot of health and wellness services. All of our clients in the housing programs and the residential programs work with our nutritionist, they work with our recreational advisor, with our sports advisor, and we get out there and get people moving and engaged as best we can in the community, and this has been very successful for them. So this is just some of the times that you may have seen Odyssey House staff out and about. If you want to go to the next slide. Okay, these are some images from I talked about our art program. So, different times that we've had folks in to come and have a look at what the clients do. We're very proud of this, and most of our artists are not trained artists, and they got involved in creating something as part of sort of their treatment experiences. It helps them not just be in treatment longer and enjoy being in treatment, but also have something that's worthwhile to sort of follow up on when they leave. That's this one is our We Walk Wednesday initiative. This is a community-based group that comes mainly from the Odyssey House Haven, which is, I just told you about, is our permanent housing for people with medical disabilities. We get out there every Wednesday and they participate in the community gardens initiatives around East Harlem, but they also can bring their family and friends with them. That's a permanent housing building where people, they aren't in a treatment program for Odyssey House. They are living in the community, just like everybody else. And we look for volunteers to participate in this and to get involved with us. And, and these folks are great as volunteers themselves and work on the local gardens. And, a lot of stuff in the libraries. These things aren't open right now because of COVID, but when they were, this was a very active community group. There's just a couple more slides. This one, I don't know if this is going to work and if you guys even want to do this, but we're very proud of this. The Odyssey House team ran in this year's marathon. We weren't sure they were going to have it, whether the city was going to do it or not, but they did. And so, we got some very nice coverage from New York One, who sort of adopted us as their Feel Good Friday. I don't know if you really want to watch a video. I don't know whether that's going to be effective.
Yeah, I mean, we can have the link separately to watch later. This will be made available to everyone, but I just in the essence of focused on time and making sure that your colleagues can also present. I would love to.
That's fine. I just figured I wouldn't do that too. Plus, I'm not sure the technology will all come together. So we leave that alone. So that's really the end of the overview of Odyssey House. There's lots of ways to reach us. I'm always available to reach anytime. And yes, the presentations from my colleagues are going to be more in terms of you have sort of questions for them.
Yeah. And I think we do. So a couple of things. And one is if there's an annual report or anything of that nature that you can also forward along or send to us. The three key things that we like to ask all of our service providers is first of all, how many people do you service? And I know you have different facilities. I actually used to live on the corner of 121st. So I was your neighbor for a very long time. And I'm born in, I've lived here for over almost 50 years. So I'm very familiar with Odyssey House. So the first is how many people are you servicing? And I know you have permanent and semi-permanent and different levels of of services that you provide, but how many people are you servicing? The second part is we always want to know how many of them are East Harlem residents. They may be residents now, but for those that might be coming or referred to Odyssey House, how many of them are technically East Harlem residents or have a tie or grew up in East Harlem? And then third, what, if anything, are you doing differently because of COVID? So those are the three that we seem to be asking everybody the most. And I know that our committee and the public might have other questions, but just to keep you in line with other presentations, I just want to make sure those three items are covered. So, yep.
I can answer those real fast for you. The first one is like, how many people do we have in programs? We have a capacity of up to 564 residential beds. Those aren't all in East Harlem. Actually, let me just get that right. Gabe, how many do we have between in the Manor and GRCR? I don't know if Gabe's on the call. All right.
Hi, can you hear me?
Yes.
Yes, we have 100. We have 165.
Okay.
165 at the Manor, and then up to 100.
140 at the Manor, 125 at GRCR.
Okay, so those are the residential beds in East Harlem, which I focused on with what you asked me for in the presentation. Across the Odyssey House system, and we are exclusively New York City based. We don't have any services outside the city. We have like 564 residential beds. That's the capacity in the drug treatment. We do have 450 supportive housing, semi-permanent, permanent housing slots. And then we do run a parolee intervention program at Edgecombe, which is the Department of Corrections facility in the West Side. And then we also have outpatient services that are based in the Bronx and a recovery center that's also based in the Bronx. So that's the overview of the Odyssey House programs. We typically think we have up to about 2,000 people engaged in one of our services on any one day. But those are people actually in the program. There are a lot more people that benefit from Odyssey House services and information that don't actually come in that we refer on to different programs. It's a very active admissions unit that does a lot of that actually. In terms of how many people would have a zip code from East Harlem, about 13.5% of our residential programming are people that would identify with those zip codes. That's kind of been consistent for decades. Sort of hasn't shifted one way or the other. And then the third question is, what are we doing differently because of COVID? I think I alluded to it. We did have to limit our admissions from about April 2020 until August 2020. And then the state allowed us to increase admissions in. And then we've had to slow down and bring it back and go back and forth like that. The main thing that we do is that we offer vaccination on site. We were early offering that. We provide all of the PPPs for staff and for clients. you know, and have introduced so many protocols and procedures to keep everybody safe. That's really what we've done. And it's been effective for us, we think. We're very glad to report on that.
Thank you. And so I'm going to open up to questions from our committee members for the team from Odyssey House. If you could please raise your hand and wait to be called on. Okay, oh wait, I was gonna say, Eva, it wouldn't be a night if you didn't raise your hand. I really was wondering if maybe you dropped off the call. I'm gonna call on our colleague, Eva Chen. Eva, question or comment?
No, well.
I was like, what happened here? Sorry, this is
No, I've been
Eva.
paying attention.
Eva's been waiting for you guys in Mount Sinai to come.
So my question is, do you track your the recovery rate of your patients? And related to that, we've been told that residential treatment provides a much better outcome than outpatient services, or just giving out methadone. Can you comment on that?
Yeah, in terms of residential treatment, that is, the preferred treatment for an individual whose substance abuse and sort of life circumstances, if you like, are so significant that they need to be in a place of safety, such as a residential program, which is a very sort of, confined situation to work on substance abuse issues. So, it's not appropriate for everybody. Not everybody needs to go into a residential program, but those that do need it, yes, residential services are the best model for that. It's been proven over and over again. In terms of success rates, the success rates for substance abuse, I have to couch it with the provision that it's a chronic relapsing disorder. It is not once and done. Wish it was, it just isn't. And if anybody's tried to quit smoking, they might identify with that, or tried, even like trying to quit an amount of sugar that we all eat. It's the same thing. It's going to take a while. So the residential programs, the longer you're in, the more engaged you are in the program, the better you're going to do when you leave. We offer programs that run up to 6 to 9 months, and so we do have a commitment to long-term treatment. We won't dismiss anybody or let anybody go from our programs unless they have a clear plan for what they're going to be doing next, where they're going to live, how they're going to support themselves. The thing that we focus on as soon as you come into an Odyssey House program is how you're going to manage relapse and what are you going to do when you leave. It is not about staying in our program. It's about how we're going to get you out of here, but how we're going to get you out of here healthier and able to progress in your life. So that's the residential model. And it's intensive. And, when I said we have 560 beds, that may not sound like a lot. That is a lot, actually. That's a lot. And New York City is one of the biggest supporters of treatment programs in that way.
And what do you think is your sense is the actual demand for this service? And because the reason why I'm asking is the latest data from Oasis have indicated that New York City has lost 1,500 beds over the last 10 years.
Yes. Yeah. I mean, it has lost beds with funding. It has lost beds with social service organizations not being able to, piece together programming because of the funding. And, and so the effort has come from that really to reduce the number of beds. We have not lost any beds at Odyssey House. We have remained stable. And I think one of the reasons why we've been effective in that is that we have a broad range of services within our programs, right? So that we provide healthcare, we also provide educational services, housing assistance, etc. So the level of intensity of our programs has sort of helped us really piece together appropriate funding to maintain these buildings. Plus the organization has, we've built good buildings, we've built good programs, we've invested in very good staff. Gabriel Ramirez, my colleague who's on the line here with me, is an example of that. And that's really how we've been able to maintain system. And yes, we have a waiting list for some of our programs, for some of them we don't. It fluctuates day by day, and it can certainly fluctuate month by month. Does that answer your question?
Isabel, I just want to ask a question about something you just stated. You said that there's a waiting list. Could you give us, just, briefly, but could you tell us like what services have a waiting list and what that number looks like?
The waiting list for our services, Gabriel, I'm sure Gabe might be able to answer on this one as well, is for the elder care programs by and large, and also the housing programs.
Yeah.
Those are where we have the waiting list. In terms of a young adult wanting to come into a treatment program, they can walk in off the street and we can take them in and see to their needs. Absolutely.
Okay, thank you for that. Any other questions before we move on to the next presentation? So Isabel, thank you so much. If you could send along an annual report just so we could dig in a little deeper if you have one. Also have a question. Do you have a CAB, a community advisory board at Odyssey House, and is there a member of CB11 that sits on it?
We do not have an active community advisory board at this point. It is something that we can talk about, certainly. We had Fernando and I had talked about this one ahead of time. There was one many years ago. It became, I think, sort of difficult to keep people engaged in it. But that is certainly something, if the community, folks like yourselves on this call, at this committee meeting, want to be involved in something like that with us, we can certainly have a conversation about that. Our board of governance is board of directors. They're all volunteers. They meet 4 times a year. That's really our board right now. But community board would be something that I would be very welcome, actually, to work with you all on.
Thank you. Eva, I'm so sorry. I didn't see your hand raised in the hand raise, but I did see your hand go by. I wasn't sure if you were saying goodbye or if you had a follow-up question, because I want to get on to the Mount Sinai.
Yeah, I have a simple follow-up question. So given the tremendous loss in residential bed in New York City, and it's 35% loss in 10 years. So I want to see if I can partner with you to help better advocate for this issue and just raise awareness, because it's really serious. So I want to know, how can I get in touch and what is your recommendation?
This presentation has my email and my cell phone. You can reach me. I don't have access to yours, but if you want to reach out to me, or if anybody community board can send me their information, I can follow up with you. Do you work in the substance abuse arena?
No, I'm just a local resident.
Okay.
Just being interested.
Curious.
In the topic.
Okay.
Thank you. Thank you, Eva. Thank you, Isabel. I'm happy that you and your team came. Please know you always have an open invitation. We want to make sure that we are building deeper ties between our community board and our service providers, and that we are elevating the good work of our good neighbors here to address the needs of our underserved and those most in need here in our East Harlem community. So next, I'm going to turn it over to our last formal presentation for the evening, which is going to be from Mount Sinai Hospital. Thank you, everyone, for your patience, both to our presenters, our committee members, and the general public. Brad, I guess I'm going to start with you, and then you can kind of walk us through what comes next.
Absolutely. And again, thank you for everybody. And most of our focus, at least I hope I didn't misunderstand, really we're led to believe that you really wanted a discussion regarding behavioral health and addiction services in particular. So with me tonight, we have Dr. Pramit Singh, who actually heads all of our behavioral health services. He will do most of the presenting, as well as from our community relations team, Christopher Consalvo and Brad Korn. And we'll answer any questions you have at the end. But just first, I'm going to do 2 things. High level of who Mount Sinai is. I think a lot of this folks know, so I'm going to go really quick, and then we'll really turn to the behavioral health issues. But we are now a health system. We actually have 8 hospitals located, obviously, in Manhattan, Queens, Brooklyn, and South Massa. Obviously, we have an anchor medical school. System-wide, we have roughly 43,000 employees. About half of those are at Mount Sinai at 98th and Madison, between the hospital and school. We have 7,000 physicians. We have more than 400 ambulatory practices. We have 2,000 medical residents. We have approximately 135,000 inpatient visits or discharges a year. We have more than 3.7 million outpatient visits annually. Our emergency rooms have more than 400,000 ED visits or emergency room visits each year. And we have a total of about 3,800 inpatient beds at Mount Sinai Hospital at 98 in Madison. That number is about 1,200. So all very large numbers. And again, happy to answer any questions. Obviously, with that, we're totally committed to working with you. We're committed to working with all the communities that we serve to address the health disparities. But I think really most of the focus tonight, my understanding, was really about addiction services that we have, in particular regarding drug rehabilitation and chemical dependence, those that we have located in East Harlem. And then we're going to address a little bit about those that we have system-wide. And candidly, here in East Harlem, we actually do not have, and then I'm going to turn it to Pramit and he'll correct me. We do not have any chemical dependency beds. Actually, those beds are all either at Mount Sinai West or Mount Sinai Beth Israel. We do not have any outpatient addictions programs on our campus. The only addictions related facility that we have in East Harlem is we have a methadone OTP clinic, whatever the right term is, at 125th Street and Park. I think many folks are aware of that. And I know that in particular, you had, questions and concerns about our longer term plans, considering, the resolution, the longstanding resolution that CB11 has opposing, bringing any additional chemical dependence programs to East Harlem. We have no plans to bring additional programs, OTP programs, chemical dependence programs into the East Harlem CB11 district. So with that, Dr. Singh, I'm going to turn it over to you. If you can just expound on that a little bit. And then I think really it's probably most productive to spend most of our time taking some questions, but I think we really want to focus on behavioral health. So Pramit, do you want to take it from there?
Sure. Thanks, Brad, and thanks everyone on the meeting for having us and inviting us to speak. As Brad said, I'll give you a quick overview of the system as far as addiction services go, and maybe behavioral health, and then I'll speak a little bit more about what's in CB11 area. So as a system, as Brad said, we offer pretty much the whole range of addiction services. We have inpatient services, both detox and rehab at the Beth Israel campus, as well as the Mount Sinai West campus. We have outpatient programs located also at Beth Israel campus and the Mount Sinai West campus. We don't have any addiction services on the East campus, that is Madison and 100th Street, that lies in CB11. So what we do have then, I should just say quickly that at Mount Sinai Morningside, across the park, we do have a very small high school that runs on the hospital campus that treats adolescents and high schoolers that have either mental health difficulties or substance use challenges in combination with the Board of Education. So then in East Harlem, what we have as far as addiction services go is, as Brad mentioned, opioid treatment programs that are located essentially at 125th and Park Avenue. So that's kind of the range of services. Again, there's no plans to expand those services within CB11 or anywhere else for that matter. A word or two about the opioid treatment programs on 125th Street. I think that in general, as an addiction psychiatrist myself, that methadone, was really gained popularity in the 60s and 70s and expanded tremendously thereafter. And then in the 2000s has really been somewhat augmented by the use of buprenorphine or Suboxone, as many people know it. Our goal is, Suboxone in many ways is a much better treatment. I think that methadone programs in general tend to, I won't say dehumanize, but I think they demand way too much of the patients in treatment. That is, people are required to come in every day for a while, and then every other week for a while, and I mean every other day for a while, and it sort of gradually tapers down, but it locks people in, it gets in the way of their lifestyle. And buprenorphine or Suboxone allows for office-based treatment, which means that you could go to a doctor's office, get a prescription, just like any other medication, and have it filled at a pharmacy. And so that's a much more, I think, respectful and humane way to treat folks that need opioid replacement therapy. And I think over time, we have seen in some of our OTPs a gradual shift from methadone to Suboxone. I'll quickly say that, yes, there are a number of patients who need to remain on methadone and clearly benefit from it way more than they would from Suboxone. And obviously, those folks continue to do that. So that's sort of the overview of addictions treatment within Mount Sinai. For behavioral health and psychiatry, again, I'll give you just a very quick overview. We have inpatient beds pretty much scattered around the system. There's about 50 of them at the East Campus, which is in East Harlem, as you know, in CB11. We have about 100 of them on the West Side, and then about roughly 100, maybe a little less, at Beth Israel. So they're pretty much equally scattered. Mount Sinai Hospital actually has the least. It's the smallest. We also offer outpatient outpatient behavioral health services, again, at all our campuses. The volume is different at each campus. So the East Campus typically has about 40,000 visits in mental health. The West Campus has about 100,000 or more, and Beth Israel is closer to about 50 or 60,000 roughly for behavioral health visits. So again, there are all levels of services, essentially ranging from partial hospitalization to regular outpatient treatment that kind of span across the system. And I think one of the advantages of becoming a system is that we've been able to offer sort of a very wide range of services within the system. And so people, once they come into the system, they can kind of get whatever treatment they need or require or are best served by. So I'll stop there and see if people have questions. That might be a better way to go.
So I'm going to open the floor to our committee members. If you could please raise your hand if you have a question or comment from the team from Mount Sinai, so that I can recognize you to be able to unmute. In the interim, I have a quick question. So I was born at Mount Sinai and I've lived in this community for a very long time. Brad knows my mom worked there for 50 years. I said this earlier. I know that the East 125th Street corridor has received lots of attention in recent years. I do want to stress that it is one corridor of our beloved neighborhood, not the entirety, and I don't want our neighborhood to ever be defined by one corner or one block. But could you just talk a little bit more about the services that are provided at your site on that East 125th Street corridor, just so that people have a fuller picture of what's there? How many people you're serving, how many people that you're serving there are from the East Harlem community, kind of the same questions we asked before. What may you be doing differently in COVID? Like, are you doing any sort of remote stuff to limit the traffic? And then I'll open, I see Eva has raised her hand. So if you don't mind, just a little bit more detail about what's going on at your 125th Street site. How many people are you serving there? How many people are from East Harlem proper that are getting services there? And then I will take the questions.
Okay, sure. So let me start with on the East 125th Street location, we serve approximately 16 to 1,700 patients.
Is that annually, weekly, daily?
That's the total number of patients that are enrolled in that program.
Okay.
The way it works with methadone, for those who aren't familiar with it, is patients that have trouble with opiates of any sort come into a replacement therapy, as methadone is known. And when they first start treatment, they are required to come in 6 days a week. And then it gradually diminishes over time as they establish more time away from the drug that they were using that was problematic for them. Once they're on methadone, the need for opioids diminishes and goes away and is extinguished. And then they remain on methadone and simply take that as a replacement. Now, they undergo regular urine testing, counseling, group therapy if necessary, psychiatric care if that's warranted, and primary care. much of which happens at those clinics. But as time goes by and they have more time away from the drugs, so basically over a period of 6 months, they might go from coming in 6 days a week to coming in 1 day a week. So it's a gradual cutting back from 6 to 5 to 4 to 3 to 2 to 1. Until recently, federal regulations, and pretty much all of this is regulated very strictly by SAMHSA and the federal government. Until the pandemic, and now I get to the second part of your question about what's different with pandemic. Until the pandemic, the least someone could come in was 1 day a week. So if you were doing really well and you hadn't used any illicit opiates for 3 years, you were still required to come in 1 day a week, and then you would take home 6 days worth of medication. That's pretty frequent for someone that has a job, a family, wants to travel, go on a vacation, do all kinds of things. The pandemic actually brought us something that should have happened years ago, but didn't. So here's the silver lining to the pandemic, if there was one, is that the federal government and SAMHSA relaxed this requirement and said, you can now allow people to come in once every 2 weeks and even once every month. And so people who had been coming in once a week for decades, literally decades, could now come in once a month. And interestingly, early research and experiences from that clinic itself show us that they haven't fared any worse. They aren't using any more drugs than they were before. Their rates of positive urine toxicology screens to measure the outcomes of treatment didn't get any worse. And it seems more and more like over the country, and particularly over New York State, which has the most methadone programs, that there is a movement to get the federal government to relax these regulations on a permanent basis so that even after the pandemic, people can come in once a month, which is kind of like going to your pharmacy once a month. So that's one change. Yes.
Yeah, and correct me if I'm wrong, Prameet, if I have my data wrong here, but if you're really getting at, the number of visits, as a result of all of this, we have seen is it about a 25% reduction in the number of daily visits to the sites, or am I off on that? I thought that's the number I had heard.
Actually, Brad, you're quite far off, because in fact, and I'm glad to say this in a way, is that we've seen almost a 50% reduction.
Okay.
Now it's back up to more like 40%, but at the height of the pandemic, it was 50%, which is great because that means people are coming in less and yet they're doing just as well. So that's been the result of the pandemic. The one other thing that we did as a pilot, not out of the 125th side, but out of our west side, and I only mention this because it might be here to stay and come to the east side, to the East Harlem side as well, is we started to do some home deliveries, particularly for the elderly patients and for those who are more vulnerable to the effects of the COVID virus. And that too was quite successful. And so we are considering starting that up at the east side as well. Actually, Oasis has asked us if we might be interested in doing more deliveries so that we can home deliver medication and not have people come in. So that's the effect.
Both of which would decrease the footprint on 125th Street. So that's really good to know.
Exactly.
And provide service to those who are vulnerable and may be in need of that. So that's very important. So the reduction is interesting. The home delivery service is interesting. The other question I just asked, and Brad and Dr. Say, I don't know if you guys have this information, is do you know of the 1,600 people enrolled, how many of them are residents of East Harlem or had ties to East Harlem before? Because there's a lot of conversation about oversaturation. There's a lot of conversation about people coming from outside of the neighborhood, some of which were commuting very far to receive services. It's a mixed bag. I'm happy that we have such important services to offer to our neighbors across New York City, but also wanting to make sure that our neighbors locally here in East Harlem aren't then in reverse being sent somewhere else because there are no more spots or spaces here for them. So I don't know if you guys know of the 1,600 enrolled in the program, how many of those, if by percent or exact number, are located here in East Harlem?
So I can speak to that a little bit. I'm afraid I don't have the number of enrolled patients that live in East Harlem. I can tell you, however, that roughly at the East 125th Street location, about 46 to 48% of individuals have Manhattan addresses. Again, I don't know where in Manhattan, but they're in Manhattan.
So 50% of the people getting served are local to Manhattan. But if you could, you guys can email us. If you could fine tune that
we'll get it
a
to you,
little
Nye.
bit.
Yeah, the exact
so
number for these Harlem
10035,
ships.
10029 zip codes. It's
Yeah.
very important to us to make sure that we are understanding that framework in terms of our service providers.
Okay.
I
we can
would
get that to you.
One other thing that you had raised is, does this deprive folks that live in East Harlem from accessing those services? The answer to that is no, because we still have open slots. In other words, our license number is greater than the number that we are serving. So someone that lives in the community would certainly not. The other thing I just want to say, even though you didn't ask this question, but I think that it's a worthwhile question to ask, is the folks that are coming here that don't live even in Manhattan, why should they need to travel? And you know, recently we've started to work in small bits and pieces with Brad's help with the regulatory agencies to try and see, because very often they're coming here because they can't get treatment in their own neighborhoods. And what we're trying to do is to partner with OASAS and other agencies to see if we can use their influence to get these patients treatment in the neighborhoods that they live in or work in, and not have to. Now, and finally, and I'll stop there, some number of those patients prefer to get their treatment in Manhattan or at 125th Street because they work here. So they're coming into work. And until recently, as I mentioned, they had to come in once a week. And that's brutal. I mean, none of us want to go to a place once a week. So I think that we are working to try and actually decrease the foot traffic even further with several of these measures. I'll stop there.
Thank you. So just a quick follow-up. One, yes, and yes. This community board, as you know, is about fair share. And we think that there at least should be the option for someone to have services in their community local to them, though we do know people may exercise for whatever reasons the opportunity to go elsewhere. But secondly, you said that the 1,600 enrolled is not the full capacity. What is the full number of capacity? And is it specific to East Harlem, or is it across the entirety of your system?
The full capacity is specific to the East Harlem location. So every location has its own capacity. I don't know what it is off the top of my head, but it's about 1,700 and change, maybe 1,800. It's a little bit more. It's about 100 more, if that, not much.
It's under 2,000 per meet. I know that. Yeah.
Okay.
I think you're right on.
Well, Eva's right in there. It's 1,850. Okay. So thank you, Eva, for your patience. And so Eva, you have the floor.
Thank you. Yeah, so I just want to follow up with Nye on the request for patient data, because when we asked OASAS for data, some other Harlem providers do have pretty good data of the zip code of the patients, but OASAS didn't have very good data from Mount Sinai. So hoping to get that from you.
Yeah, we'll get that back to Eva. We can pull that.
The other question I have is, what do you see as kind of policy efficacy that we can help with in terms of improving the rate that patients are being converted to buprenorphine or telehealth? Are there any sort of pricing discrepancy in terms of how Medicaid is paid out? Or, there are certain services that doctors are not getting adequately compensated for. What do you see is the shortfall right now?
I just want to piggyback on that. There was a conversation earlier that we learned about from a different service provider who informed us that they weren't getting reimbursed for telehealth at the rate that they thought they should, because of course you had to train the person on how to use a computer or tablet. They had to get them computers and tablets to even be able to participate, help people get Wi-Fi service, et cetera. And so the path to putting someone on telehealth, wasn't being reimbursed at the rate that they thought they should be, because it was less than a physical visit at the early time of COVID, even though it was actually more labor intensive. So I just wanted to give you an example to share some context, but thank you, Eva, for that question. And the floor is open to anybody from Mount Sinai to answer.
So I think reimbursement has not been a deterrent, fortunately. So I don't think that's really what's keeping it. I think that the bottleneck, I think there are there are a couple. One is, I think that switching people from a methadone to Suboxone, it involves it's a little bit of a, I don't know, it takes a little bit of encouragement from the providers. There is a lore or I mean, patients are reluctant to do that. They're not always eager, despite the advantages that we see. I think sometimes patients are reluctant. That's part of it. I think the other is that until recently, and maybe even now, the number of freestanding sort of providers of Suboxone was kind of low. And this has been a problem across the country. It's not just a problem in New York. It's been a problem not only with the Sinai system, but with any system in New York. I think that one of the advantages of being a larger system like ours is that we shouldn't face that barrier. In other words, if we can convert enough patients, and actually we've done a little study at a smaller clinic at Mount Sinai West, which again doesn't fall in this community board, but is part of the system, is there's a roughly, I mean, just to give you some numbers, about almost a third of the patients are currently on Suboxone, which that's a pretty significant number, a third. At the 125th Street location, I think the number is closer to 10% or maybe even less. So I think that requires us to turn our efforts now to this location, and to try and get to that same level that we can. And hopefully we will not face a barrier of where to send these people once they've been converted, because not only do we want to convert them, we then want to send them to office-based treatment. We don't want them to come to 125th Street. We want to go into a provider in their neighborhood, maybe even their primary care doctor. I mean, you don't need to have an addiction person prescribe this medication. Many primary care doctors do prescribe it and are willing to prescribe it. So I hope that answers your question. If I didn't, please.
Help in terms of your effort to convert the patients on the East Harlem side.
You know, I wish I had an easy answer to that. I think that there needs to be more of I think it's something that we need to do. I think we need to take more initiative and put more of an effort, sort of make this our goal. I'm an addiction psychiatrist by training. I've been in this role for about a year. So it naturally, I'm paying much more attention to addictions than most other, addictions generally get short shrift in any healthcare system. Fortunately, the Sinai system has very large addictions treatment programs and a large history of addictions treatment programs. And I feel like we have that we are well on the way to making that change. But if I can think of a way that you or the community would be helpful, I'd be happy to pass it along to you. I just can't think of anything at this moment. I think it's going to take, spread the good word. Tell people, hey, Suboxone is as good as methadone, or I've heard that you don't have to go into the doctor's to pick up your medication, and that's much better. But other
for example, we can, have government to provide funding for more peer outreach service, to have people, talk to your patients, maybe not in a clinical setting, in a way they'd be more comfortable, so they might be more receptive to the message.
Yeah, no, that's an excellent suggestion. We've actually reached out to increase specifically at 125th Street our funding for peers, because we find peers to be a much more effective way, as you said. And so we've already actually spoken to Oasis, and they've agreed principally to help us with increasing the number of peers that we employ.
You have to have credible messengers to have success in anything, whether it's gun violence, whether it's addiction, recidivism, et cetera. So I see that there are two on their hand raised, and it's almost 8 o'clock. So Gabriel, did you have a question or comment? I wasn't sure if that was from previous.
Mine was more of a comment, because at Odyssey House, we have close to 70 people that are also co-enrolled in the Mount Sinai on 125th. And I have to say that our partnership is really fantastic in that, one, when it's time for them to pick up their medication, they're escorted by clients, and Mount Sinai gives us at least 2 weeks worth of medication, so they don't have to go on a daily basis. And for those clients that are not mobile, we become their designated other. So they never even see the clinic, once a month. And the partnership between the counselors is extraordinary in that they make sure to communicate with one another at least monthly, so that we know that they're taking urines over there and we're taking urines over here, and is there a positive over here? So I just wanted to acknowledge that in the face of this pandemic, we were still able to coordinate and service this population. So
thank you so much. And I think we need to talk about that more. I really appreciate that. I feel like we need more ways to communicate how our different service providers are working in partnership, whether it's referrals, et cetera, and how our community is working together to support those in need. So I thank you, Gabriel, for saying that. And I'm sorry, Doctor, were you going to add to that, Dr. Singh?
I was just going to say to Gabriel, what we'd like to do is to set up a service where none of your patients ever have to come, that we just deliver this to your facility and they don't have to come to the 125th Street location.
Yeah, we're talking to Oasis about that too.
Well, let us know how we can help.
Will
If there's,
do,
a letter of
for sure.
support or, anything that we need to do to help make that happen. And then I see that our new chair, Xavier Santiago, has his hand raised. Welcome, Chair. How are you? Happy New Year.
Happy New Year, everyone. Thank you, Nai. You guys have started off with a bang. Thank you for the presentation. Brad, haven't seen you in ages. Dr. Singh.
Good to see you, even though remote.
Yeah, remote. Yeah, and I'm sorry, I'm managing a little bit of homework because my kids are virtual this week, unfortunately. But so our big thing, and I think Nai, our chair of human services, has been, and everyone on this committee, I cannot express enough, we do care about our fellow neighbors here in the community. We understand, and many of us share stories with those that have suffered with whether mental illness or substance abuse, addiction, and the chord was struck earlier about fair share. But I think our bigger thing is that, and when we have the road to recovery, and Dr. Singh, I'm sure you and I could have a very lengthy conversation about preventative and holistic healthcare and how we achieve recovery and what are the root causes of addiction. Our major issue is that as we have dealt with Oasis and been, for lack of a better phrase, championed at the bit to have the real dialogue. When we had the event that happened where we had the safe injection site or harm reduction placed in the community, despite having an earnest and honest dialogue back in October, where information was withheld, which is tantamount to lying. And we found that out on the day when we did a site walkthrough. Our big concern, and is expressed through many families and others, is how can we do both? And part of that is how can our community partners, such as Odyssey House, Mount Sinai, and that are positive players, what can we do better together? And then redistributing services to people's area where they reside. And I know there is some embarrassment that comes along with addiction and having to face that reality amongst your neighbors and family and friends, knowing this firsthand from several family members who suffered. But again, we have been carrying the undue burden. And so what we look forward to, and I guess if you could speak more to, since you have now a healthcare network, a system in place, how we can look at being better players at large within the New York City landscape.
And are you talking, Xavier, primarily behavioral health or all issues?
All across the board, because again, you're in today's meeting presenting more as an overall healthcare provider, in which many of these same issues dovetail together, or there is overlap. And I think our thing, we're trying to suss out who are the good partners and who are, it's kind of like the old movie, The Good, the Bad, and the Ugly. Where do we find ourselves? And so we can make a better decision and our positions and our advocacy. So that's, and I guess the question more directly to both of you, Dr. Singh, are, in what way are you ready to partner with us and to get us the data points we need with services that are being provided to local East Harlemites, those that are just outside of the bubble, and then further beyond, so that we can find a way to redistribute services where necessary. So they're reaching the individuals who need it most closer to where they live.
We're absolutely willing, and Permit, you can expound on this, to partner with you in any way, and any data sets that you need, any information, we're more than happy, to provide that. And as Permit said, we're already beginning early discussions with Oasis, how better to redistribute much of this population, so people get their care closer to home.
Yeah, and you can, this is Gabriel again, you can count on me for those discussions as Odyssey House for those discussions as well.
Yep, perfect. And we can partner together on that.
Yeah, and thank you all. I just want to
one
also
follow-up, Nye, real
go for
quick.
it.
One follow. Yeah. So again, and I'll share what was stated when Nye and our former chair Nilsa Rama and Angel Muscane, with a mother of 2 children near that site at 126, said is, look, I don't care if it's a Harry Potter version of platform 9 3/4, where people go in, they come out, and no one knows any better. That's fine. What we don't want are the issues of the leeches, and I use that term passionately, of the drug dealers and others who come to take advantage of those who are suffering. We want to help those and help them recover, but I think the larger part is that they want to find a way to where it blends in and we're not shouldering the weight. So that your data sets will help us on that journey so that we can go back and have the real conversation with Oasis, DOH, MH, and say, hey, we need to reconsider how we're dealing with this issue affecting our community and the city and state and nation. So, thank you.
And thank you all. I'm gonna make a comment. I'm gonna do one more question, and then we're gonna close out. I wanted to also just kind of go back to the beginning when we said, yes, there is a resolution in place for people who may be new to this meeting. The Health and Human Services Committee last year in March passed a resolution which we're asking everyone to please sign on to share with local elected officials. But the goal at the heart of it was that we foresaw that there might be increased need for services like this as a or that we had an opportunity to put was here to identify our longstanding good partners and to further collaborate with them, to identify other partners in the community that might need to be fine-tuning or tweaking their services, and to address some of the oversaturation that we felt was going in a very concentrated 10-block radius of our communities. Also tapping into that as the spaces on Ward's Island. And so I invite you guys to continue this dialogue with us, like hearing that story about that partnership with Odyssey House and Mount Sinai is amazing. Hearing about the fact that you're doing delivery to decrease the footprint, amazing, and increasing, services to those in need. We want to hear those stories, and we also want to just keep continuing the dialogue around how we can be supportive. So if you're applying for a grant or you're applying for funding or you're having these conversations with Oasis and there's a letter of support that we can provide, or we can be on a call with you in some way to be supportive, we want to continue to be able to do that and keep that dialogue open. So thank you guys for being here. Thank you for promising to get us the follow-up. Let's stay in touch. Eva, you said you had one more thing and then we're going to close out.
Yeah, so in the spirit of what Nye just said, we, in the process of working with Oasis, we've obtained quite a lot of data from Oasis. So I'm just pasting this link in here, and I'll get the Excel data for you if you're interested, basically showing that New York City has lost 19% of drug treatment capacity in the last 10 years. And it's primarily being lost in gentrifying neighborhoods. A lot of these clinics are turned into luxury buildings, and it's just really disheartening to see. So I just want to offer myself up. If you have any, I'm happy to help you kind of look through data and identify, potential needs where districts have insufficient services. But regardless, this is the link. I'm going to put the Excel link on there in case you're interested in the data. Thank you.
Thank you, Eva. Thank you, everyone, for this presentation. I don't see any other hands raised. Do you, Marlene?
No, there aren't any hands raised.
Okay. Thank you to all of our guests and presenters for your support and for your commitment to our community.
You have a hand raised in the attendees, but
Crystal Glover, how can I help you, Crystal Glover, before we move on to our next item?
Oh, I'm sorry. I guess I can wait, but let me ask you something. Good evening, crew. The last meeting you had someone there from the mayor's office on mental health. It was a female, I don't remember her name. She gave a lot of information that was very pertinent. Y'all said that, or she said rather, that you can actually go to the library or to the community board office to get an actual visual copy of her presentation, also literature and things of that nature. I went to the library about 2 weeks ago. They don't know anything about it. So I guess it's too soon in the year. We have a new mayor, etc. So if you can recall that meeting and the stuff that the woman spoke on from the mayor's office on mental health, the respite program they have, the emergency, this and that, and all that. Is there a phone number I can call to find out?
Yeah, so two things, Crystal. First and foremost, thank you for the question and thank you for participating.
You're welcome.
You can always go to our CB11 website for minutes. Every committee posts their minutes. So usually the contact information from any of our speakers would be in the minutes from our previous meeting, which we just approved today. So therefore it would be posted, this week, or you can call the CB11M office. Marlene Pierre, who's our committee liaison, can help you track down who the speaker was. They usually send us copies of their PowerPoints and presentations. I was away last month, so I phoned in. So I don't recall which speaker that was, because I wasn't able to participate for the whole meeting, but Marlene can assist you in finding that person, their presentation, and connecting you to them.
Yeah, it was really, really good. I'm sure everybody can agree.
Yeah.
And what's the one last quick small thing I wanted to say? What good is having all this information if it doesn't get to the people? Because we have a lot of community leaderships, whether they be TAs, BAs, or whatever, but it doesn't get to the people.
I agree with you 110%.
Yeah,
and
yeah,
I always
okay.
say it's a team of we, and my favorite word is voluntold. So I am volunteering you, Miss Crystal Glover, to bring next month some of those TAs and some of those leaderships. This is on Zoom now, which makes it way more convenient for people to participate. And I, like you say all the time, that our CB11 website has tons of information. We have listing of every service provider, every school, every organization in our community that people can tap into. We talk about all the issues in our subcommittees and in our full board meeting. So I'm gonna ask you, Sister Crystal, to bring a friend. Thank you
I'm not accusing
so much for joining us.
I'm not accusing.
Our next agenda item.
I'm not accusing.
Thank you, by the way, for
CB11.
everybody for having us.
Thank you, Brad. Good night. So we have two more items on the agenda that I don't want us to lose. So if you could just bear with us a few more minutes. Marlene, I know we were supposed to talk about kind of just a recap of what kind of goals and priorities for the upcoming year and accomplishments from the past year.
Yes.
Yes. So I just want to give a
3
minute.
each would be sufficient.
I'm sorry?
3 items each would be sufficient. 3 items in 2022 and 3 items that were accomplished in 21 would be sufficient.
So I'd like to ask the members of the committee, if you could please, by raise of hand, if you would like to contribute. We need to document what are some accomplishments that we've had in 2021 and goals for 2022. So I'd like to ask our committee members to please raise their hand to add to this conversation for our minutes and for our report to the executive committee. Don't make me call on you.
I don't know if you consider this, this is Gabriel. I don't know if you consider this an accomplishment, but just a partnership between Mount Sinai and Odyssey, I feel is a fantastic accomplishment.
Thank you, Gabriel. You just took our committee members off the hook, but the members of the committee are still on the hook. Gabriel fielded you as softball. What I would say, Gabriel, and as chair, I'm going to take a little chair's privilege and just kind of restate that. which is inviting our service providers in and using this new questionnaire that this committee has created, I think has led to many educational, informational, and fruitful conversations. So I thank everyone who is a member of the Health and Human Services Committee who has helped us work on that questionnaire and who has worked with us in inviting and phoning and calling and setting up connections, or should I say reconnecting to these service providers and organizations. Eva, I saw your hand up. We need a accomplishment from 21 and a goal for 2022.
I was just going to repeat what you said, which seems to keep happening. So yeah, I mean, I think the survey and just being able to invite service providers, and also we passed the moratorium. We also have Nilsa, writing a letter of dismay to express the need to consult CB11. I think that's all good. I think going forward, similar to what you asked, for us to get more better represented in CAPS, I think that would be a really good next step. Just to be able to continue to have dialogues such as this with the bigger providers, because sometimes just a nuance doesn't need to be discussed in public, and we can get more done.
Yeah, awesome.
My main goal, I think.
Thank you, thank you. Thank you, Eva. Pastor Isaac Scott, floor is yours, my brother.
Hi, now. I think that, I don't know if this counts, but I think one accomplishment over the past year is that this board has been able to better acknowledge the humanity and the process of the folks who are receiving the services from these drug programs that come before us that we talk about all the time. So I think that we've been able to, make better requests because we're not coming from the space of, oh, I don't want that in my community, to, really understanding what it really means to be community. So I think in that way, it's a moral accomplishment. I think that as a goal, I would love to see that expand, to each and every person in the community, whether they're contributing positively or negatively, because some of the same people, we talk about in this, heard the word used, leeching, and the same young people we may be talking about, being problematic. In this committee, at the Youth and Education Committee, we're talking about trying to save those same people. So I think really just understanding better the connections between each person's life in East Harlem is a goal that I would love to see. But yeah.
Awesome. Thank you so much. And I know you and I are going to have a call later this week. So want to talk to you how we can make sure that we're bringing more heart and more humanity to our conversation. So thank you, as always, for your work and for keeping us focused on the people, right, that we are here to represent. I see some other hands raised. But I can't see who the people are. Okay, Jennifer Mayer, is it Meyer? Jennifer, the floor is yours.
It's Meyer. Thank you.
Meyer, great. Sure.
Yeah, I think we've been a really great source of COVID information for the community. And I know, even for myself working at Mount Sinai, I learn a lot about Mount Sinai in these meetings that I don't even learn at work. And I learned so much, I'm able to share with my neighbors and my friends about the COVID resources, which I think has been really critical this past year, especially as all the new variants have popped up. So I think that's definitely one accomplishment. And I think just to echo a lot of what we've been saying for the goals, I think just increasing these connections that we have and really bringing the community into the connections as well, and making it not just between us as the board and the partners that we work with, but remembering all the community members.
Awesome. Thank you. Eva.
Yeah, I forgot to mention another, I think, accomplishment, I think primarily from you really, is helping to pull all the COVID resources together and having these regular speaking spots for the providers. I think that's really helpful.
Yeah, no, I agree with you guys. Thank you. And I think it's important that I feel like we've been developing some relationships in a different way. Like I know our community knows certain people, but we've been developing, I think, some new and deeper relationships and having some hard conversations, which I think, help us to better reflect and better serve and take action. So thank you all. I don't see any other hands raised. So Marlene, on the agenda, I guess we have like old business, new business. I don't believe we have anything in either area, but I'm going to open up the floor to the committee members for any items of old business or new business. I will just say for old business, the survey is still continuing to be out there. We ask every service provider that's coming to complete that survey. So we are now compiling a folder with that information, with stuff like how many patients, how many beds, what other services they provide, how many years they've been in the community, what portion of their patients or constituents served are from East Harlem, et cetera, et cetera. So we will be able to have that as a shared Google Drive for this committee and for the board to have access to that information going forward. And I think that's really important in terms of how we work with one another and what more we can do to make sure that people have access to the service they need. I often hear people say, oh, we don't have this or we don't have that. And actually, if you go to CB11M.org, you'll see that our community has a range of services. We just need to help get the word out about it more. To Crystal's point of earlier. Any other old or new business? Okay. It's 8:15, Marlene. Am I missing anything else that was on the agenda?
No, if you're ready, I could call the roll.
If you could, please. We're going to do one more roll call for our committee, but in the meantime, thank you to everyone who was patient enough to stay. It's 8:16. We're going to call the roll and then be ready to close out. Marlene, the floor is yours.
Thanks. Eva Chen.
Present.
Sandy Garcia. Robin Krinsky.
Present.
Patricia Martin.
Present.
Jennifer Meyer.
Present.
Thanks. Shirley Pena. Arturo Perez.
Present.
Thank you. Pastor Isaac Scott.
Present.
Robin Strachan. And Nye Whitaker.
Present.
Okay, thank you, Nye.
So I don't think we really need to vote on this. So I guess we'll do a verbal vote. If there are no objections to us adjourning this meeting, if there is an objection, please raise your hand. I'll give it a minute. Otherwise, I believe we can close out. Marlene, is there anything else?
No, that's it.
All right. Thank you, everyone, for this informative discussion today and for your patience as always. First meeting of the year. Happy New Year. I look forward to working with you all to better improve our services in our communities. Thank you, everyone. Good night.
Good night. Thank you for having me.
Thank you. Thank you. Thank you.
Thank you, Night.
Good night.